And the brain itself, in the brain we will get two cerebral hemisphere, one cerebellum and the brain stem. It looks like a tree. So tree has got stem, so it has got brain stem, and brain stem has got three parts, that is midbrain, pons and medulla, and over which we get the topmost structure, that is the cerebrum, and below that we get the cerebellum. Now what is cerebrum? Cerebrum comprises of two cerebral hemisphere, right and left cerebral hemisphere, and it is been divided by one longitudinal fissure which divides these two, divides the cerebrum into two cerebral hemisphere. This is the fissure which is longitudinally present from anterior to posteriorly, which is called median longitudinal fissure, which divides the two cerebral hemisphere. And we know these two cerebral hemisphere, they are connected with each other by a commissural fibers, and that is called corpus callosum. What is the function of corpus callosum? Those who are interested, please stay here, and those who are not interested in wearing the apron, please leave the class. Leave the class. You have got enough time to wear your apron. Yes, I am calling you. Please leave the class. I will ask questions continuously. So the two cerebral hemispheres are connected with each other with a commissural fiber, that is called corpus callosum. This is, and in each cerebral hemisphere we get outer grey matter and inner white matter. Is a half of a sphere, and outer grey matter and inner white matter we will get. And even within the inner white matter we can get some scattered grey matters. Those are called subcortical grey matter. So outer cortex, that is comprises of grey matter, and inner medulla which comprises of white matter. And within the white matter, that means within the subcortical area, we can get again some grey matters. And so subcortical grey matters consist of the basal nucleus or basal ganglia. So we will learn later on. And within each cerebral hemisphere we get a cavity. That cavity is called as lateral ventricle, and that lateral ventricle contains a fluid which is called cerebrospinal fluid. So the brain consists of cerebrum cerebellum and brainstem, that is midbrain, pons and medulla. And from your early childhood you know brain is divided into forebrain, midbrain and hindbrain. Forebrain means this part, that is the cerebrum, okay, which is also called, and also there is another part which is the thalamus. So the forebrain comprises of cerebrum and thalamus, which is called prosencephalon. Next is the mesencephalon, that is midbrain, which is part of the brainstem, and rhombencephalon, that is the hindbrain, that is the pons medulla. Okay. So, and cerebellum also. So within this is the part of the prosencephalon or the forebrain, and this forebrain, inside the forebrain we get another area in between forebrain, that this is cerebrum and midbrain, we get the thalamus. So thalamus plus this cerebrum as a whole is the forebrain or the prosencephalon. So this cerebrum is also called the telencephalon, and thalamus is called diencephalon. So telencephalon, that means cerebrum, and diencephalon, that is the thalamus, they actually as a whole creates the prosencephalon. So prosencephalon has got telencephalon, that means the cerebrum, and diencephalon, that means thalamus. The next one is mesencephalon, that is midbrain, then pons, medulla and cerebellum, that is the hindbrain. Now we are concerned with the telencephalon or the cerebrum. Now cerebrum has got, you can see there are some elevations, you can see, and in between you can get some depression. The elevated parts are called the gyri, and there are some depressions which are called the sulci. Why? Why nature has created such gyri and sulci? To increase the surface area of the brain. So as from generation after generation we are getting intellectually developed, intelligently we are getting developed, and more there are sulci, more there are gyri, more there is the surface area of the brain. So that will represent, that is that they are becoming more and more intelligent, and intellectually they are more advanced. Now there are some longitudinal fissure we can find, which is called the medial longitudinal fissure, and brain contains, actually covered with a membrane which is called meninges, which has got outer dura, then arachnoid, then most inside we get the pia matter. Okay. Pia matter is intimately attached to the brain, and we can see some subdural folds. The outer dural, which has got endosteal layer and meningeal layer, which forms and fold. In some places it folds, and that within the longitudinal fissure we will get the falx cerebri, that is the fold of dura matter, which is called falx cerebri, which looks like a sickle. It is sickle-like, so it is called falx cerebri. That it is present in between these two cerebral hemispheres. Now, there are borders. This is a two-dimensional structure, so it is very hard to understand what are those borders. They are, one is superolateral border. In the brain, we will show you. Okay, there are, the borders are actually running from anterior to posteriorly. Okay, one is forming the lower part, and it is called inferolateral border, and one border is superiorly, which is superomedial border, and again another border is present in the base of the brain, which is present medially, so that is inferomedial border. So superomedial, inferomedial and inferolateral borders. Similarly, the outer surface is called the superolateral surface. Each cerebral hemisphere has got outer surface, which is called superolateral surface. And medially we can find a flat surface, which is called medial surface. And inferiorly we can get another surface, which is called the inferior surface. So, superomedial, inferomedial borders, superolateral surface, medial surface, and in the lower part, that is the inferior surface. Now, about the poles, here we can find that this is the anterior part of the cerebral hemisphere, this is the posterior part. Anteriorly, there we get a pole, which is called frontal pole. Posteriorly, we are getting another pole, which is called the occipital pole, and inferiorly we are getting another pole, which is called temporal pole. Now, we get several lobes. We can see in front we are getting frontal lobe. Just behind the frontal lobe we get another lobe, which is called the parietal lobe, and behind and below we are getting another lobe, that is the occipital lobe, and behind and in front we are getting another lobe, which is the temporal lobe. How this nomenclature or naming of these different lobes are given? As per the presence of frontal bone, parietal bone, occipital bone and temporal bone. Frontal lobe is more or less situated within the frontal bone. Just below the parietal bone we are getting the parietal lobe. Below the occipital bone we are getting the occipital lobe, and inside the temporal bone we are getting the temporal lobe. So they are named as per their situation with the cranial bones: frontal bone, parietal bone, occipital bone, temporal bone. Now here, this is the outer surface, which this shows the outer surface, and here we can get some sulci. Sulcus singular, sulci plural. Plural number, that is the sulci. So here we can find one sulcus which cuts the superomedial border, we can see which runs obliquely backwards, and it is around 1 centimeter behind this is the frontal pole, this is the occipital pole. If we make a midpoint between the frontal pole and the occipital pole, it is almost 1 centimeter behind that midpoint. And it starts from the supromedial border and it runs down and obliquely and it goes up to, we know this is the lateral, there is another sulcus which is called lateral sulcus. It goes towards the lateral sulcus. So this is called central sulcus. Another sulcus which starts from the inferior surface and it is visible in the superolateral surface, and it has got several fractions, and it is continued as in the superolateral surface as a lateral sulcus or posterior limb of the lateral sulcus, and it is also called the lateral sulcus of Roland dome. Okay. And another sulcus we can find here within the occipital bone, that is the calcarine sulcus. Another sulcus we can find within the frontal lobe. This is the frontal lobe. One is present. In other picture it is very much prominent. Okay. So I will show you in other picture. Okay. Next sector bhalo picture. Here we can, if we can identify these sulci, then we can identify also in the viscera. Okay. So one sulcus you can find, there are two sulci present within the frontal lobe. One is above and one is below. This is called superior frontal sulcus and this is called inferior frontal sulcus. So they divide this frontal lobe into 3 gyri. This is superior frontal gyri, middle frontal gyri and inferior frontal gyrus. Similarly, we can find this is the central sulcus and this is the lateral sulcus. And lateral sulcus starts from inferior surface and it is continued on the superolateral surface. And it has got 3 components. One is anterior horizontal, one is anterior ascending, and one is posterior limb of the lateral sulcus. This is central sulcus which is visible in the superolateral surface and touches the posterior limb of the lateral sulcus. And there are 2 sulci, one is present in front and one is present behind the central sulcus, and therefore they are named as pre-central sulcus and post-central sulcus. So there are, again I am repeating, superior frontal sulcus, inferior frontal sulcus, superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. Lateral sulcus is divided, it has got 3 components or limbs. One is anterior horizontal, anterior ascending and posterior. So accordingly we get 3 gyrus. One is called orbital gyrus, or pars orbitalis, next is pars triangularis, and another part which is called pars posterior. And the stem of the lateral sulcus is continued as the posterior limb. Now you can find this is central sulcus, in front is the, we are getting pre-central sulcus and post-central sulcus. Thus we are getting two lobes. One is, two gyrus. One is in front and one is behind the central sulcus. The gyrus which is present in front, it is called pre-central gyrus, and gyrus which is present behind, which is called the post-central gyrus. Now this pre-central gyrus is related to the motor activity, and post-central gyrus is related to the general sensory activity. Grossly, you can remember one thing, that is, this frontal lobe is concerned with the motor activities, whereas this parietal lobe, which starts from this central sulcus onwards behind, this parietal lobe, it is concerned with general senses. This is occipital lobe, is concerned with vision. General sensory and spatial sensory. Spatial sensory means audition, vision, taste, the sensation from the skin. So spatial sense, that is the vision which is concerned this, and this occipital lobe is concerned with vision, and this temporal lobe. Temporal lobe is concerned with audition. So, frontal lobe is for motor activity, parietal lobe is for general sensory activity, occipital lobe is for vision, and this is the temporal lobe which is concerned with the audition. Okay. So, again I am coming to this area. This is the pre-central gyrus and this is post-central gyrus. This pre-central gyrus, in the pre-central gyrus we get the motor area brought, actually the functional area had been divided by several scientists. Among them, the Brodmann's classification is most accepted. So this Brodmann's area 4, or the and this is the motor area, or Brodmann's area 4, is concerned with general motor activity. Okay, suppose I have decided to kick a football. So that signal is coming from from this motor area, general motor activity. And in front, there is another area in front of this pre-central gyrus, which is called the area 6 or premotor area, which is again integrating the movement, the motor movement. That means primary motor area is area 4, which is directed to kick the football. Well, but it has not governed how much force or thrust I should apply. That will be governed by that premotor area. So, primary motor area, secondary motor area, and there are motor association areas. So, remember this is motor area 4 and this is the in front the motor area, this is called premotor area, which is the area 6, which integrates the movement. And again, that integration is also done by the cerebellum. You will gradually know. When that impulse is coming down through the pyramidal tract, because pyramidal fibers are coming down from here, the upper motor neuron fibers, they will reach the spinal cord. Before reaching, they will give a signal to the cerebellum. And cerebellum will again control, integrate, whether that should be, that the pull or push should be how much. So in cerebellar disease, there will be pass pointing. You cannot point the nose. Either it will go in front or it will touch here. But the person cannot touch the tip of the nose, which is called pass pointing. So again I am coming to the motor area. So motor area, that is the precentral gyrus, and the premotor area, this is the area 6. Similarly, in the frontal lobe, which is called prefrontal area, area 9, 10, 11, 12, they are located in the anterior part of the frontal lobe, which is called frontal areas. They are concerned with our personality development, our concentration, our reaction to the society, our reaction to the common people, foresightness. All these are being controlled by that area, that is called, that is present in the frontal lobe, prefrontal area. When we are concentrating, that concentration is actually directed by that prefrontal area. If we can develop that prefrontal area, we can concentrate. We can judge nicely. We can develop our personality. We can do proper behaviors with our colleagues and our friends, with our friends. So any affection of that area will lead to affection of all these modalities. That means development of antisocial activity. So that area is affected, which is called anti-personality disorders. So in that case, the prefrontal area is affected. Or in a child, that is very much common nowadays, that is the attention deficit hyperactive disorder. The child with ADHD. In that area, that prefrontal area is affected. So any therapy which is directed for them is development of the prefrontal area. Okay. Now in the This is the inferior frontal gyrus, where we can find there are the stems of lateral sulcus, which is called anterior horizontal, anterior ascending parts are entering. This inferior frontal gyrus, within the inferior frontal gyrus, we get the Broca's area of speech. Speech, if this area is affected, not all sides of the same hemisphere, it is placed, nature has placed this Broca's area on the left cerebral hemisphere in case of right-handed person, and vice versa. That means on the left-handed person, the Broca's area is situated in the inferior frontal gyrus of the right side. And up to some age, this Broca's area can change. Like after 6 years, 8 years, after which what will happen? If the Broca's area of left side of mine is affected, I cannot speak. Yes, it is affected. Suppose if I develop the right-sided hemiplegia means paralysis of right side or left side. Suppose this hemiplegia, there is a right-sided hemiplegia, that means paralysis of right side. That means there is a lesion in the left cerebral hemisphere, there is a cerebrovascular accident in the left cerebral hemisphere, and in that case, that Broca's area might get affected. And if that Broca's area is getting affected, what I will develop? Aphasia, motor aphasia. I cannot speak. Okay, so motor area or Broca's area, area 44, 45, they are located on the dominant hemisphere, where in the inferior frontal gyrus, this is the area where we can get the Broca's area of speech, which is, it is located in the dominant hemisphere, and it is located in the inferior frontal gyrus of the dominant hemisphere. Because we are the right-handed person, it is the left side is the dominant. In the left-handed person, the right side is dominant, so it is located in the right side. That means right inferior frontal gyrus. So again, this is about the frontal. Now in the parietal we can find one sulcus, which is called intraparietal sulcus. Intraparietal sulcus, and this intraparietal sulcus divides this parietal lobe into two parts. One is upper part, one is lower part. Upper part is called superior parietal lobule. You can see it here. And this is the inferior parietal lobule. You can see it here. Okay. This is the inferior parietal lobule. This is the superior parietal lobule. Here we can find in the parietal lobe, the posterior limb of the lateral sulcus enters into the parietal lobe. This is demarcating the frontal and temporal. Then it is going up. It is upturned end of the lateral posterior limb of the lateral sulcus. It enters, and we are getting one gyrus, which is called angular gyrus. This angular gyrus is area 40. Similarly, we can find in the temporal gyrus, temporal lobe, there are two sulci. One is superior temporal sulcus and middle temporal sulcus. This superior temporal sulcus also reaches the parietal lobe, and over which we can get a gyrus, which is called angular gyrus. So supramarginal gyrus and angular gyrus. Supramarginal gyrus, this is area 40, and this is angular gyrus is area 39. This area 39 is an area which is just like a Webster dictionary. It integrates so many information. Informations are coming from the occipital lobe. Information is coming, that means any vision. What we read, the letters, ultimately this gets memorized within the area 39. Like, it's a word dictionary. And if we hear anything, any music or anything, any frequency of the music or anybody's voice, they are being carried out to the area 39 and 40. So this is the highest area, association area for both audition and vision. So supramarginal gyrus and angular gyrus. Okay. Similarly, we can get the superior temporal, middle temporal gyrus. This gyrus, here we can get the primary auditory area. The area 41, area 42, area 22, they are actually, we will get, actually more precisely we will get, this is the lateral sulcus. If we retract the lateral sulcus, we can get a Hassel's gyrus, transverse gyrus, where we can get the area 41, 42. They are actually part of the superior frontal gyrus, middle frontal gyrus. They are the area for audition. What we are hearing passing through, these all are passing through the auditory nerves. And ultimately they reaches the medial geniculate body, just remember. And from there it goes up and ultimately it reaches the highest center, that is the area 41 and 42, which is located in the temporal lobe. So affection of the temporal lobe will lead to what will lead to loss of hearing. Okay. From there, it ultimately comes to area 22, 21 and area 40. They are called Wernicke's area, which is just for our conversation. There are two components. First we hear, then we speak. First we hear, then we speak. So, hearing, ultimately it is related to the superior frontal gyrus. And from here, that is area 41, 42, from here, there is another area, that is area 22 and area 39, 40. They are called secondary audition area, auditory area. Primary is the 41, 42. From there, it is being carried out to the area 21, 22 and 39 and 40. They are called the Wernicke's area or secondary auditioning area. From there, ultimately, it is connected with the inferior frontal gyrus through a lobe which is called the Hassel's gyrus. First, this is the area 41, 42, the primary auditory area. The secondary auditory area, from there it is been carried out to area 21, area 22, they are located in the superior temporal gyrus. And this is 39 and 40, which is called the angular gyrus, and this is supramarginal gyrus. It's carried out to that area, secondary. And ultimately, it will be converted into the speech. So speech has got first, that is the sensory area of speech. The sensory area of speech is area 21, 22, area 39, 40. Sensory area. And motor area of speech, that is the Broca's area, that is area 44, 45. And they have been connected with each other by an arc. Arc means there is a gyrus, which is called transverse gyrus of Hassel, which is evident when we retract the lateral sulcus, we can find that. So this is the conduction. It helps in the conduction from sensory audition to motor area of speech. এই যে শুনলাম, শোনার থেকে এবার বলা, এই যে বলছি, this area is Broca's area, and they are being connected with by the Hassel's gyrus. So what we can get in sensory aphasia, we cannot sense the words. Before we have to speak, the motor suppose this motor area is all right. Motor area of Broca, area 44, 45 is all right. But if the lesion is in the area 41, 42 or in the area 21, 22 and 39 or 30 and 40, there will be sensory aphasia. They cannot sense properly. If we cannot sense, how you can speak? So sensory component, motor component, and in between there is a conduction. So sensory aphasia, conduction aphasia, and motor aphasia. There are three components. Sensory aphasia, motor aphasia, conduction aphasia, and motor aphasia. So primary, just forget everything, but remember area 41, 42, this is the primary area of audition that is present in the superior and middle temporal gyrus. An area, that is Broca's area, that is the area 44, 45. And remember area 39, which is integrating center both for vision and both for the audition. Okay, this is the Webster dictionary, basically. In old age, it may be affected. The person can sense, especially, I will come to this area. Here we are getting one sulcus, which is called the calcarine sulcus, which is more prominent in the medial surface, which is called the calcarine sulcus, post-calcarine sulcus. And around this this sulcus, the visual area is oriented. Visual area, that means area 17, primary visual area. It is located around, it is called axial sulcus because around the axis of this sulcus area 17 is located. Then area 18 is located to the periphery of it. Then area 19 is located most peripherally. So area 17, 18, 19. 17 is related to primary visual area. Primary visual area. Area 18 is related to secondary visual area. And 19 is more precise. Suppose in an old age, what happens? The old people, they can identify the person, but he cannot recollect his name. He can sense. Sensation is given by area 17, which is called visio-sensory area. And area 18, 19, which is called visio-psychic area, that means which is meant for the memory. Memory of this, of the object. So he can sense this person, but he cannot remember. দেখবে বাবা তোমার নামটা কি জানো because what happens, the area 18, area 19 is affected, or from area 18 and 19 actually the input is given to the visual association area, that is to the area 39, angular gyrus. So primary visual area, secondary visual area, and tertiary or visual vision association area, that is the area 39. So they are related to each other. If 17 is affected, I cannot see anything. From the retina, from the eyes, from the retina of the eyeball, optic nerve, optic chiasma, optic tract, and lateral geniculate body. From there, ultimately, optic radiation, and ultimately it reaches the occipital lobe, area 17. Now, I should not say much about the occipital lobe, but here we can find one lunate sulcus around the post-calcarine sulcus. You can see the calcarine sulcus is also starts from the this is the medial surface. This is outer surface, which is called superolateral surface, and flat medial surface. This is flat medial surface. We can see it in the viscera. And in this surface we can find the corpus callosum, the cut margin of the corpus callosum, which has got several parts. The posterior part is called splenium. This is called the body. This is of the central part. And this is the genu, means any turn. Any turn is called the genu. And this is called the rostrum. So we can find this is the corpus callosum. And just above the corpus callosum, we can find one sulcus, which is called callosal sulcus. Callosal sulcus. Just above the corpus callosum, so it is called callosal sulcus. And another sulcus we can find, which is 2 fingers above this corpus callosum, which is S-shaped, look like an S-shaped, which is called cingulate sulcus. cingulate sulcus. This sulcus is called cingulate sulcus. Okay. From here, from the cingulate sulcus, one stem goes above and it reaches the superolateral surface. An area in between the cingulate sulcus and this component, this is called the paracentral lobule. Paracentral lobule, which is visible in the medial surface. But you can see here, this is the central sulcus. This goes inside the medial surface and divides this paracentral lobule into two parts. One is in front, one is behind. The part in front is this is the motor area, and part behind, this is the sensory area. So this paracentral lobule, I told you, this motor area and this is the sensory area. You can imagine one person is lying down and doing Sirsasana in the motor area. That means the person's head is below and leg is behind. Okay, it is resting. That means the body is represented in the motor area or sensory area while ups and down. That head is down and legs are in the upper part, and the lower limb and the perineum will touch the medial surface. I will show you a picture here, which is called motor and sensory homunculus. That means body is situated. That means this is called motor homunculus. This is the superolateral surface. Face is represented here. Then hand and trunk. Then lower limb and is represented on the medial surface. This is called motor homunculus. You will be taught in the same way in your physiology class also. Okay, you can see, you have seen this peculiar thing in your physiology book also. You might have some question, what is it? What is it? কি দেখছি এটা? কেন? So that is nothing, this is the representation of the body. Okay, this is called motor homunculus. So this area, this is the motor area and sensory area. So in both cases, this is the central sulcus. Here we are getting the central sulcus. This is the motor area. This is the sensory area. Whether it is motor or sensory, body is represented like this, as if a person is doing Sirsasana in motor area or sensory area. So you can see the medially we are seeing this the lower limb and the perineum of the body. That means, so here, this is the medial surface and this is the continuation of the central sulcus in the medial surface. Here we are getting the paracentral lobule, which has got motor and sensory component. And they control the lower limb and the sense of bladder, sense of bowel, they are being carried out to this area. And evacuation of bladder, that means the motor activity. Evacuation of bowel is a motor activity which is being done by this area. So paracentral lobule is area which is concerned with the bowel and bladder movement of opposite side of the body, and also about the movement of the lower limbs and senses and movements of bowel and bladder. So that is paracentral lobule. Very, very important. If that area is affected, bowel and bladder reflex will be affected. Okay. Now, this is the cingulate gyrus. This cingulate gyrus is actually starts from here, lower part. In the inferior surface, this part is called the uncus and the parahippocampal gyrus. From here it starts, and it is a part of the limbic system. Limbic means ring-like. Limbus means ring. Here is the ring. This is the cingulate gyrus, uncus and parahippocampal gyrus. So, which is also called the limbic lobe or limbic system. They are concerned with our primitive activities. They are related to they are concerned with our emotion and primary urges, primitive urges, and about the struggle in a very awkward situation, struggle for existence. They are all related with this limbic system. Now, in the lower surface, in the inferior surface, we can find one sulcus. This sulcus is called collateral sulcus, two parallel sulcus in the inferior surface. Though it is medial surface, actually it is a part of the inferior surface. Here we are getting one sulcus. This sulcus is called collateral sulcus, and this sulcus is continued from occipital to temporal lobe. So this is called occipitotemporal sulcus. So in the inferior surface, which is visible here, we can see two sulci. There are two sulcus. One is, and they are parallel sulcus. One is collateral sulcus. One is occipitotemporal sulcus. This collateral sulcus and this is the calcarine sulcus. They are called the complete sulcus because they goes inside the brain matter, the cerebrum, the tissue of the cerebrum, and inside what we are getting? One cavity, what is called lateral ventricle, and they touches and creates an impression over the lateral ventricle. So they are called the complete sulcus. They are present through and through. They goes inside and touches the lateral ventricle, and they creates two impression. One is created by this calcarine sulcus, which is called calcar avis in the posterior horn of the lateral ventricle, and collateral eminence in the inferior horn of the lateral ventricle, which is called collateral eminence. Collateral eminence and calcar avis. They creates an impression over the posterior and inferior horn of the lateral ventricle. So they are called the complete sulcus. Complete. Incomplete, that they cannot reach up to the depth. So here we can find several gyrus accordingly, which is called parahippocampal gyrus, and around the occipitotemporal gyrus we are getting lateral and medial occipitotemporal gyrus. This is the inferior surface of the brain. Here what we get, olfactory bulb and olfactory tracts. Okay. Okay. And medial to this olfactory bulb and olfactory tract, we can get a straight gyrus, which is called gyrus rectus. Gyrus recti. And here this inferior surface is divided into two parts. One is in front, one is behind. This is called orbital surface and this is called tentorial surface. Because it rests over the tentorial cerebri of the dura mater. You will learn gradually. So this is called posterior tentoral surface and this is the anterior orbital surface. And here we can find one H-shaped sulcus which is called orbital sulcus, which divides this orbital surface into anterior, posterior, medial, lateral orbital gyri. Similarly, in the posterior part, which is also already I have covered, that is the collateral sulcus and occipitotemporal sulcus. Before concluding, I want to show you this one. We have retracted, as if we have retracted the lateral sulcus. There is another lobe. How many lobes are there? Frontal lobe, parietal, occipital, temporal. No. And limbic lobe. No. There is another lobe which was present in primitive time in the surface, but which is revealed when we retract the lateral sulcus. We can find another lobe which is called the insula. Insula or insular cortex. This is a lobe. Actually, it was present in the surface, but due to development of the surrounding lobes, it has submerged. It has been submerged by the surrounding lobes. That means frontal, parietal, occipital lobes. And ultimately, this lateral sulcus is formed. Actually, that lobe was present in the surface in the primitive times, but due to development of frontal lobe, parietal lobe, occipital and temporal lobe, it has gone inside. This is called insula. Insula is again concerned with emotion and primitive activities. And lateral sulcus is a secondary sulcus. It is not present from the beginning. As insula has gone inside. Suppose in geography what happens? This Andamana land, Gondwana land, and in between development of Himalaya pressure, or Himalaya is here, but after suppose thousand decades later, it may go inside. The Himalaya may go inside. Similarly, this insula was present in the surface and it has gone inside. And ultimately one sulcus is formed, that is secondary sulcus, that is the lateral sulcus.